Come in.
Hi, Mrs. Smith. My
Hi.
name is Rachel. I'm a nurse here, and I'm going to be taking care of you today.
Nice to meet you.
Nice to meet you, too. Do you understand why you came in here yesterday?
Yeah, so I was having really bad chest pains at home, so I ended up calling 911, and they brought me in, and they wanted to just keep me overnight to rule out a heart attack, but it ended up just being angina.
And do you know what angina is?
The doctors described it, but I don't really understand it.
Okay, so what angina is it's chest pains caused by problems in your heart. So your heart has blood vessels on the outside of it that carry blood and oxygen to the heart so it can work properly.
Mm-hmm.
And with angina, these heart vessels become a little bit narrowed because of plaque buildup.
Mm-hmm.
So I brought a little diagram that you can see here. So this is a normal blood vessel of your heart. The blood moves smoothly, and that's a cross-section of it. And then in this one, you can see the plaque is kind of cutting a little bit off, so the blood has a harder time getting to it.
Oh, okay.
So you can keep that if you want.
Thank you.
So those blood vessels become narrow due to plaque buildup that can be caused by a poor diet.
Okay.
So when those blood vessels become narrow, the blood can't get to the heart as well, and that causes the tissues of the heart to die, which is what causes your pain.
Oh, that sounds kind of scary.
Yeah, it is. It can be, and it can be really serious if you don't get ahead of it and treat it. So that's why we're going to give you the tools you need to manage it well and get ahead of it.
Okay. So what do I do to, avoid this plaque buildup here?
So plaque can be caused by eating too many foods with high fat content, like fatty meats, like bacon and fatty pork and stuff like that, or a lot of fried food or a lot of fast food.
Okay, so just make healthy choices in general, and that should help?
Yeah, for sure.
Okay. And what happens if I get the chest pain again?
So the doctor is prescribing you nitroglycerin, and that's a medication that you can take when you're having chest pain, and it'll help subside the chest pain because it opens up the blood vessels that are already narrowed.
Okay, that makes sense.
So I'm going to go get you some more information on that, so I'll be right back.
Thank you. Hi, Mrs. Smith. I'm Ashley. I'm going to be the nurse getting you ready for discharge and going over the medications that you're going home with.
Okay.
Do you know what medication that is?
The other nurse said nitroglycerin?
Yeah. Do you know how it works?
She said it'll help my angina by opening up the blood vessels.
Yeah, that's right. Do you know how to take it? Did she go over that?
No.
Okay. So it's going to come in a small pill, and you're going to want to put it underneath your tongue and let it dissolve. You don't want to chew it. And a good way to remember how to take it is called the 3x5 rule.
What is that?
So essentially you can take up to 3 pills 5 minutes apart. So you're going to take the first pill, and if that doesn't work, you want to make sure that you call 911 right away, because it could be a heart attack. So we just want to keep you safe and get you here in case that's the case. And while you're waiting for the ambulance to come, you take a second pill 5 minutes after the first. If your chest pains are still persisting, then you can take a third pill 5 minutes after the second pill. And then after the third pill, you want to stop and don't take any more after that. And by that time, the ambulance should be there and get you here safely. But if your chest pains improve after the first pill, then that's great. It just means that it's angina, and you can stop taking it after the first pill. So I know that's kind of a lot. It's kind of been confusing. So does that make sense to you?
I think so. So when I'm having chest pain, I'll take 3 of these pills, but start with 1. And then if it doesn't get better, I'll call 911, wait 5 minutes after the first, take a second, and then wait another 5 minutes and take a third, but no more than that?
Yes.
Okay.
And then if your chest pain is good after 1 pill, just stop after 1 pill.
Okay.
Perfect. And then I just want to go over the side effects of it so you are aware. So some of the most common side effects can be a pretty bad headache that can cause blurred vision and symptoms like that. And then also hypotension, which is low blood pressure, which can lead to faintness and dizziness and feeling super weak. So when you take this medication, you want to make sure that you stop what you're doing and you sit or lie down so that if these symptoms do arise, then you're in a safe spot and nothing will happen.
So if I get a headache, it's okay? That's not a bad sign?
Yeah, so these symptoms mean that the medication is working, but if it seems to be getting worse or it's been going on for a really long time, just be sure to call your doctor. It's always better to be safe than sorry. You can call your doctor whenever you need to, and then we can figure out what's going on.
Okay. That seems like a lot. Do you have, like, any information I could take home with me?
Yeah, so I actually brought in this handout right here. Okay. So it has information about what the medication is, how to take it, what the side effects are, when to call your doctor, when to go, when it's an emergency, when to go to the emergency room, everything like that. So I can give that to you and you can read it before you leave to make sure you understand everything.
Okay.
And then I just want to reiterate that this medication helps with the symptoms of like the chest pain in the moment. It gets rid of it right away. But for angina, you want to make sure that you're aware of your eating choices and your diet because did you go over the plaque buildup with the past nurse?
A little bit, yeah. Rachel told me a little bit.
Okay, so she described how, like, the eating choices can affect the plaque buildup?
Yeah, like
okay.
Avoiding fatty foods.
Yeah. Do you have any questions about that?
No, I think I'm good. Just, like, eat more, like, salads and stuff as opposed to going to McDonald's every day.
Perfect, yeah. So I can get you another handout that gets you, that lists all some healthy foods and things for you to try.
Awesome.
But do you have any more questions or concerns about anything?
I think I'm good. This is really helpful. Thank you.
Okay, so I'll let you get ready, and if you have any more questions, you can let me know. But transport will be up in a minute to help get you out of here.
Okay,
It was nice meeting you.
Thank you. You too.
Good. So the first teaching method we used was teach back. So we asked the patient to repeat back what we told her about nitro after we gave her a lot of information at once, so we knew that she understood the information that we told her.
The second one we used was a visual, so we had a nice little diagram of what the arteries look like in a patient with angina, which looks like this, with a nice little plaque.
And then we also gave the patient a handout when we were talking about the medication so that she can take it home with her and in case she forgets any of the side effects or how it works or when to take it. So just a lot of information.
So that's our video!